Medical Assistant Exam Patient Intake Questions. Question 1. An office review in a quality control review shows that a patient asks which body system includes the skin. Which system should be identified? Option A, integumentary system. Option B, respiratory system. Option C, urinary system. Option D, endocrine system. The correct answer is option A, integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The respiratory system supports breathing and gas exchange. The urinary system filters blood and eliminates urine. The endocrine system is made of hormone-producing glands. Question 2. As part of exam preparation in a primary care office, the term nephrology appears in a referral. Which specialty is involved? Option A, bones. Option B, kidneys. Option C, eyes. Option D, ears. The correct answer is option B, kidneys. Nephrology is the specialty focused on kidney function and disease. Orthopedics focuses on the musculoskeletal system. Ophthalmology focuses on eyes. Otolaryngology focuses on ear, nose, and throat conditions. Question 3. An office review in a busy front office shows that a patient makes a complaint about care received in the office. Which response is most professional? Option A, argue until the patient stops complaining. Option B, post the complaint online for staff opinions. Option C, listen respectfully and follow the office complaint process. Option D, delete documentation related to the complaint. The correct answer is option C, listen respectfully and follow the office complaint process. A respectful response and proper reporting support patient relations and quality improvement. Arguing escalates conflict and is unprofessional. Publicly sharing patient concerns can violate confidentiality. Destroying or altering records is unethical and may be illegal. Question 4. After reviewing the situation in a walk-in clinic, a mask becomes wet during patient care. Which action is appropriate? Option A, share it with a coworker. Option B, replace the mask according to infection control practice. Option C, keep wearing it for the rest of the week. Option D, dry it on the clean supply shelf. The correct answer is option B, replace the mask according to infection control practice. A wet mask is less effective and should be changed safely. Masks are not shared between staff. Extended use of a wet mask is not appropriate. Used masks can contaminate clean areas. Question 5. At the start of care in a same-day appointment, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A, abandonment. Option B, patient autonomy. Option C, beneficence. Option D, respondeat superior. The correct answer is option B, patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Beneficence means acting for the patient's good but does not override a competent refusal. Respondeat superior concerns employer responsibility for employee actions. Question 6. After reviewing the situation in a pediatric clinic, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A, leave it because both patients use the same clinic. Option B, delete the form and tell no one. Option C, report and correct the filing error according to policy. Option D, ask the patient to sign a blank form. The correct answer is option C, report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Clinic use does not make one patient's document appropriate in another chart. Unreported deletion can worsen the documentation error. Blank forms do not correct the misfiled record and are inappropriate. Question 7. After reviewing the situation in a women's health clinic, a tickler file is used in the office. Which purpose does it serve? Option A, sterilize instruments. Option B, measure oxygen saturation. Option C, track future follow-ups or reminders. Option D, draw blood into tubes. The correct answer is option C, track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Sterilization requires approved equipment and process. Oxygen saturation requires a pulse oximeter. Blood collection uses phlebotomy supplies, not a reminder file. Question 8. To protect safety in a patient intake station, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Ask a coworker to change it under their login. Option B. Make an addendum according to office policy. Option C. Delete the original note completely. Option D. Ignore the error even if it affects care. The correct answer is option B. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Clinically important errors should be corrected through proper procedures. Question 9. To protect safety in a same-day appointment, a medical assistant is preparing a sterile field. Which action would contaminate the field? Option A. Reaching across the sterile field with an unsterile sleeve. Option B. Keeping sterile items above waist level. Option C. Using sterile forceps for sterile supplies. Option D. Opening the wrapper away from the body first. The correct answer is option A. Reaching across the sterile field with an unsterile sleeve. Crossing a sterile field with unsterile clothing can contaminate the field. Sterile items are generally kept in view and above waist level. Sterile forceps can help maintain asepsis when used correctly. Opening the far flap first is a common way to avoid reaching over the field. Question 10. Before the visit continues in a specialty referral visit, the assistant prepares instruments for suture removal. Which item is commonly needed? Option A. Ophthalmoscope only. Option B. Peak flow meter only. Option C. Tuning fork only. Option D. Suture removal scissors or sterile scissors according to policy. The correct answer is option D. Suture removal scissors or sterile scissors according to policy. Suture removal requires an appropriate cutting instrument and aseptic supplies according to the procedure. An ophthalmoscope is used to examine the eye, not remove sutures. A peak flow meter measures expiratory airflow and does not remove sutures. A tuning fork may be used in hearing or vibration tests. Question 11. Before the visit continues in a cardiology practice, the assistant removes gloves after contact with blood-contaminated gauze. Which action should follow immediately? Option A. Perform hand hygiene. Option B. Place the gloves in a regular drawer. Option C. Apply lotion instead of cleaning hands. Option D. Use the same gloves to clean the next room. The correct answer is option A. Perform hand hygiene. Hand hygiene after glove removal reduces the chance of transmitting microorganisms from contaminated gloves. Used gloves are contaminated waste and should be discarded properly. Lotion does not replace hand hygiene. Gloves are task-specific and should not be reused between patients or areas. Question 12. While working in an administrative check-in area, the assistant removes soiled dressings from a wound. Which practice is appropriate? Option A. Place the dressing on the clean supply tray. Option B. Handle the dressing with bare hands. Option C. Save the dressing in the patient's purse. Option D. Use gloves and dispose of the dressing according to biohazard policy. The correct answer is option D. Use gloves and dispose of the dressing according to biohazard policy. Soiled dressings can contain blood or body fluids and require barrier protection and proper disposal. Soiled material can contaminate clean supplies. Bare hand contact increases exposure risk. Biohazard waste should not be sent home in personal belongings. Question 13. Following office protocol in a specialty referral visit, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Shake the specimen vigorously for 1 minute. Option B. Leave the specimen uncovered at the front desk. Option C. Wrap the specimen in foil or use an amber container as directed. Option D. Place the tube in direct sunlight to warm it. The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light-sensitive and require protection immediately after collection. Vigorous shaking can hemolyze blood specimens. Delayed or improper handling can compromise results. Sunlight can degrade light-sensitive specimens. Question 14. The care team in a specialty referral visit asks for guidance because a used needle must be discarded after an injection. Which practice is safest? Option A. Recap the needle with both hands. Option B. Activate the safety device and place the needle in a sharps container. Option C. Place the needle in regular trash. Option D. Carry the needle to the front desk for disposal. The correct answer is option B. Activate the safety device and place the needle in a sharps container. Sharps should be secured and discarded immediately in a puncture-resistant sharps container. Two-handed recapping increases needle stick risk. Sharps can injure staff and must not go into regular trash. Transporting exposed sharps through the office increases risk. Question 15. During an outpatient laboratory, blood flow stops during a venipuncture after the tube begins filling. Which action is most appropriate? Option A. Label the empty tube as collected. Option B. Probe aggressively until blood returns. Option C. Gently adjust the needle position while maintaining safety. Option D. Remove the tourniquet and continue filling all tubes. The correct answer is option C. Gently adjust the needle position while maintaining safety. A small adjustment may restore blood flow if the bevel is against the vein wall. A tube without the required specimen must not be labeled as completed. Excessive probing can injure tissue and increase patient discomfort. Without blood flow, the collection cannot continue effectively. Question 16. At the start of care in a patient intake station, an exam room was used for a patient with a draining wound. Which step should be completed before the next patient enters? Option A. Spray disinfectant and wipe it off immediately every time. Option B. Change only the paper on the exam table. Option C. Clean and disinfect touched surfaces according to office protocol. Option D. Open the door to air out the room only. The correct answer is option C. Clean and disinfect touched surfaces according to office protocol. Environmental cleaning reduces the chance of transferring microorganisms between patients. Disinfectants usually require the manufacturer's contact time to work properly. The exam table paper does not address other touched surfaces. Ventilation alone does not remove organisms from contaminated surfaces. Question 17. As part of exam preparation in a women's health clinic, an electronic record uses an audit trail. What is its purpose? Option A. Approve insurance claims instantly. Option B. Sterilize instruments automatically. Option C. Track who accessed or changed information. Option D. Measure blood pressure. The correct answer is option C. Track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Payer claims processing is separate from record audit logs. Audit trails do not process instruments. Vital sign measurement requires clinical equipment and technique. Question 18. As part of exam preparation in a quality control review, a patient becomes angry about a long wait time. Which response is most appropriate? Option A. Tell the patient to calm down or leave. Option B. Ignore the patient until the appointment starts. Option C. Acknowledge the frustration and provide a realistic update. Option D. Blame the provider in front of the patient. The correct answer is option C. Acknowledge the frustration and provide a realistic update. Empathy and accurate information can de-escalate frustration while maintaining professionalism. Commands can escalate conflict and harm patient rapport. Ignoring frustration often makes the situation worse. Blaming coworkers is unprofessional and does not solve the issue. Question 19. While working in a procedure setup, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Pull the patient by the arms quickly. Option B. Leave the wheelchair unlocked for easier movement. Option C. Lock the wheelchair and use proper body mechanics with assistance as needed. Option D. Ask the patient to jump to the table. The correct answer is option C. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. Pulling can injure the patient and the assistant. An unlocked wheelchair can roll and cause a fall. Jumping is unsafe and unrealistic for a transfer. Question 20. Before the visit continues in a medication administration visit, a patient develops hives, wheezing, and swelling after an injection. Which action is most appropriate? Option A. Tell the patient to drive home and rest. Option B. Notify the provider and activate emergency protocol immediately. Option C. Ignore the symptoms if the injection site looks clean. Option D. Schedule a routine follow-up for next week. The correct answer is option B. Notify the provider and activate emergency protocol immediately. These findings can indicate anaphylaxis and require urgent response. Respiratory symptoms and swelling require immediate attention. Systemic allergic symptoms matter even if the injection site appears normal. Potential anaphylaxis cannot be delayed for routine follow-up. Question 21. An office review in a community health clinic shows that a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, correct limb lead placement. Option B, a properly grounded machine with still patient. Option C, poor electrode contact or patient movement. Option D, a normal calibration mark only. The correct answer is option C, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Correct placement should reduce rather than create artifact. Good grounding and stillness reduce electrical or motion artifact. Calibration marks do not explain baseline movement during tracing. Question 22. During a specialty referral visit, a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, encourage coughing and monitor closely. Option B, give the patient food to push it down. Option C, leave the patient alone until they stop coughing. Option D, perform blind finger sweeps immediately. The correct answer is option A, encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. Food can worsen the obstruction. The patient should be monitored because the obstruction may worsen. Blind finger sweeps can push the object deeper and are not appropriate. Question 23. Given the workflow in a specialty referral visit, the assistant prepares a vaccine that must remain refrigerated. Which practice is safest? Option A, use it after expiration if it looks clear. Option B, place it in direct sunlight to warm quickly. Option C, maintain required temperature storage and check expiration before use. Option D, store it in a desk drawer overnight. The correct answer is option C, maintain required temperature storage and check expiration before use. Vaccines and temperature-sensitive medications require proper storage to preserve effectiveness. Appearance does not prove potency after expiration. Sunlight and heat can damage the product. Room temperature storage can damage refrigerated products. Question 24. While working in an outpatient laboratory, a new patient completes a health history form with several medication allergies listed. Which action should the medical assistant take next? Option A, verify the allergy information and enter it clearly in the medical record. Option B, remove allergies that the patient says happened many years ago. Option C, ask the patient to remember only prescription allergies. Option D, place the form in the chart without reviewing it. The correct answer is option A, verify the allergy information and enter it clearly in the medical record. Medication allergies must be confirmed and documented so the care team can avoid unsafe orders. Past reactions may still be clinically important and should not be deleted without provider direction. Allergies to over-the-counter drugs, foods, or latex may also affect care. Important safety information can be missed if the history is not reviewed. Question 25. To protect safety in a treatment room, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A, melatonin. Option B, insulin. Option C, thyroxine. Option D, estrogen. The correct answer is option B, insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Melatonin is associated with sleep-wake cycles. Thyroxine is a thyroid hormone involved in metabolism. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Question 26. During a quality control review, a patient asks about wound care instructions after a minor procedure. Which response is best? Option A, create new instructions that contradict the provider. Option B, avoid documenting that instructions were given. Option C, tell the patient not to call if symptoms worsen. Option D, review the provider-approved instructions and confirm understanding. The correct answer is option D, review the provider-approved instructions and confirm understanding. Medical assistants can reinforce approved instructions and use teach-back to verify understanding. Instructions should match the provider's plan and office protocol. Patient education should be documented according to policy. Patients should know when and how to seek help for concerning symptoms. Question 27. After reviewing the situation in a phlebotomy station, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Eat a heavy meal immediately before every test. Option B. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option C. Ignore all provider instructions about inhalers. Option D. Wear tight clothing that restricts breathing. The correct answer is option B. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. A heavy meal may interfere with comfortable breathing for some tests. Medication instructions should follow the provider or testing protocol. Restrictive clothing can interfere with respiratory effort. Question 28. For a patient encounter in a cardiology practice, a rapid strep test requires a throat swab. Which technique is best? Option A. Swab the tonsillar area and posterior pharynx while avoiding the tongue. Option B. Swab the outside of the lips. Option C. Collect sputum from a deep cough. Option D. Touch the tongue repeatedly to collect saliva. The correct answer is option A. Swab the tonsillar area and posterior pharynx while avoiding the tongue. A proper throat specimen contacts the likely infected area without contamination from the tongue or cheeks. The lips do not provide the specimen needed for strep testing. Sputum is not the specimen used for a rapid strep throat swab. Saliva and tongue contact can dilute or contaminate the specimen. Question 29. A medical assistant is working in a procedure setup when a wet floor is noticed near the reception desk. Which action best prevents injury? Option A. Wait until a patient reports slipping. Option B. Ignore it because it is not in an exam room. Option C. Cover it with loose papers. Option D. Place a warning sign and arrange cleanup immediately. The correct answer is option D. Place a warning sign and arrange cleanup immediately. Prompt warning and cleanup reduce slip and fall risk. Prevention should occur before an injury happens. Safety hazards matter throughout the facility. Loose paper can worsen slipping and does not clean the hazard. Question 30. When a patient encounter unfolds in a walk-in clinic, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A. Record readings with date, time, and relevant notes as directed. Option B. Write only the highest number ever measured. Option C. Skip technique instructions because home cuffs are automatic. Option D. Use another person's readings if the cuff is shared. The correct answer is option A. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Selective recording can mislead clinical decisions. Proper positioning and technique still matter with automatic cuffs. Readings must belong to the patient. Question 31. At the start of care in a cardiology practice, a payer sends money with a remittance advice. What does the remittance advice explain? Option A. Where to place EKG chest leads. Option B. How the claim was processed and paid or denied. Option C. How to sterilize forceps. Option D. Which vaccine lot is expired. The correct answer is option B. How the claim was processed and paid or denied. Remittance advice provides payment, denial, adjustment, and reason information for claims. Electrocardiogram placement is unrelated to insurance remittance. Sterilization instructions are not part of remittance advice. Vaccine inventory is not the purpose of remittance advice. Question 32. At the start of care in an administrative check-in area, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Continue if the last name matches. Option B. Correct the date of birth without asking anyone. Option C. Stop and resolve the discrepancy before proceeding with care. Option D. Use the appointment time as the identifier. The correct answer is option C. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. A last name alone does not rule out an identity error. Changing demographic data without verification may create a documentation error. Appointment times are scheduling data and are not approved identifiers. Question 33. During a specialty referral visit, a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Place the patient beside an immunocompromised patient. Option B. Use only sterile gloves without a mask. Option C, skip precautions if the patient is already taking medication. Option D, apply droplet precautions and offer a mask according to protocol. The correct answer is option D, apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Separating symptomatic patients helps reduce transmission risk. Sterile gloves do not protect mucous membranes from respiratory droplets. Treatment does not remove the need for appropriate precautions. Question 34. When a patient encounter unfolds in a cardiology practice, a child needs a height and weight recorded for medication dosing. Which documentation practice is safest? Option A, record the measurements using the unit required by the office protocol. Option B, use the parent's estimate if the scale is nearby. Option C, round weight to the nearest 10 pounds. Option D, record height only because weight changes often. The correct answer is option A. Record the measurements using the unit required by the office protocol. Accurate units are essential because dosing and growth assessment can depend on precise measurements. Estimated weight is less reliable than a measured value. Large rounding errors can create unsafe dose calculations. Both height and weight may be needed for clinical assessment. Question 35. Given the workflow in a quality control review, a patient from a different cultural background describes a health practice unfamiliar to the assistant. Which response is most appropriate? Option A, tell the patient the practice is foolish. Option B, refuse to document relevant information. Option C, assume all people from that culture act the same. Option D, ask respectful questions and avoid judgment. The correct answer is option D, ask respectful questions and avoid judgment. Culturally sensitive communication explores patient beliefs while maintaining respect. Judgmental language damages trust and may prevent disclosure. Relevant patient information should be documented according to policy. Stereotyping ignores individual differences. Question 36. Given the workflow in a community health clinic, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A, ignore the anxiety to avoid making it worse. Option B, acknowledge the concern and explain the procedure in simple terms. Option C, promise that the provider will not be concerned. Option D, tell the patient the reading is probably wrong. The correct answer is option B, acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Ignoring patient concerns can increase anxiety and weaken communication. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Question 37. For a patient encounter in a patient education session, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A, the assistant diagnoses pneumonia. Option B, no documentation is needed for symptoms. Option C, patient states, I have had a cough for 3 days. Option D, patient is definitely exaggerating the cough. The correct answer is option C, patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Diagnosis belongs to the provider. Symptoms are relevant to the visit and should be documented according to policy. Judgmental wording is inappropriate and not objective. Question 38. During a primary care office, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, collect urine only when symptoms occur. Option B, keep only the first void and discard the rest. Option C, leave the container unrefrigerated unless it smells unusual. Option D, discard the first void and collect all urine for the next 24 hours. The correct answer is option D, discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Timed urine testing requires all urine during the collection period. A single first void is not a 24-hour collection. Storage requirements should follow the test protocol and preservative instructions. Question 39. While working in a pediatric clinic, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A, eliminate the need for training. Option B, replace all state laws. Option C, guarantee every claim is paid. Option D, provide standardized guidance for office tasks. The correct answer is option D, provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Policies support but do not replace staff training. Office policy cannot override applicable law. Policies do not guarantee pay or reimbursement. Question 40. As part of exam preparation in an internal medicine office, the assistant reinforces instructions for a Holter monitor. Which point is important? Option A, submerge the monitor in water. Option B, remove electrodes whenever symptoms occur. Option C, ignore the return time. Option D, keep a diary of symptoms and activities as instructed. The correct answer is option D, keep a diary of symptoms and activities as instructed. A symptom and activity diary helps correlate events with the recorded rhythm. Water can damage the device and create safety risks. Removing electrodes can interrupt recording when data are most important. The monitor must be returned as scheduled for data review. Question 41. To protect safety in a primary care office, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A, above normal or excessive. Option B, below normal. Option C, between. Option D, around. The correct answer is option A, above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Below normal is indicated by hypo. Between is indicated by inter. Around is indicated by peri. Question 42. While working in a busy front office, the assistant is checking the electrocardiogram standardization mark. Which setting is commonly expected? Option A, 100 mm per millivolt. Option B, 10 mm per millivolt. Option C, 25 mm per millivolt. Option D, 1 mm per millivolt. The correct answer is option B, 10 mm per millivolt. Standard electrocardiogram calibration is commonly 10 mm per millivolt. That value would greatly exaggerate waveform size. That value is not the common standard amplitude calibration. That calibration would make complexes appear too small for standard interpretation. Question 43. To protect safety in a community health clinic, a patient falls in the exam room. Which action is best? Option A, tell the patient to drive home without evaluation. Option B, hide the incident if no one saw it. Option C, pull the patient up immediately. Option D, call for help and assess for injury before moving the patient. The correct answer is option D, call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. The patient should be assessed before leaving. Falls must be reported and documented according to policy. Moving the patient before assessment can worsen an injury. Question 44. A medical assistant is working in a procedure setup when an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A, erase the value because it may worry the patient. Option B, send the patient home to rest without notifying anyone. Option C, recheck using proper technique and report the finding according to protocol. Option D, tell the patient that hypertension has been diagnosed. The correct answer is option C, recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Accurate documentation is required even when the value is abnormal. Abnormal readings require appropriate follow-up rather than dismissal. Medical assistants do not diagnose conditions based on one reading. Question 45. To protect safety in an administrative check-in area, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A, quality control testing. Option B, appropriate marketing. Option C, breach of confidentiality. Option D, routine scheduling. The correct answer is option C, breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Quality control relates to test system accuracy, not social media disclosure. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Scheduling does not involve posting private health information publicly. Question 46. Given the workflow in an internal medicine office, a pregnancy test performed in the office is classified as waived testing. Which requirement still applies? Option A, skip controls because waived means unregulated. Option B, use expired kits if the package is unopened. Option C, report results before the test develops. Option D, follow manufacturer instructions and quality control policy. The correct answer is option D, follow manufacturer instructions and quality control policy. Waived tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Expired test kits may give unreliable results. Reading before the correct time can produce inaccurate results. Question 47. After reviewing the situation in an infection control audit, a patient has a minor nosebleed while waiting. Which first aid instruction is commonly appropriate? Option A, pack the nose with contaminated gauze. Option B, lie flat immediately without assessment. Option C, tilt the head far backward. Option D, sit upright and lean slightly forward. The correct answer is option D, sit upright and lean slightly forward. Leaning forward helps reduce swallowing blood, while upright posture can reduce pressure. Contaminated materials should not be inserted into the nose. Lying flat can increase swallowing of blood and is not the usual first step for a simple nosebleed. Tilting backward can cause blood to drain into the throat. Question 48. The care team in a pediatric clinic asks for guidance because a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A, keep checking messages during the conversation. Option B, stand over the patient with crossed arms. Option C, laugh to lighten the mood immediately. Option D, sit at eye level and allow silence when appropriate. The correct answer is option D, sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Distracted behavior suggests the patient is not being heard. Closed posture and standing over the patient can seem intimidating. Humor can be inappropriate when a patient is distressed. Question 49. The care team in a primary care office asks for guidance because the medical assistant takes a phone message for the provider. Which information is most important to include? Option A, only the caller's first name. Option B, the assistant's guess about the diagnosis. Option C, a promise that medication will be prescribed. Option D, caller identity, contact information, reason for call, and urgency. The correct answer is option D, caller identity, contact information, reason for call, and urgency. Complete phone messages help the provider triage and respond appropriately. A first name alone may not identify the patient or issue. Diagnosis should not be guessed in a phone message. Medication decisions belong to the provider. Question 50. Given the workflow in a patient intake station, a patient has an irregular pulse during routine vital signs. Which measurement method is most appropriate? Option A, count for 10 seconds and multiply by 6. Option B, count the pulse for a full 60 seconds. Option C, skip the pulse and record not available. Option D, use the patient's previous pulse from the chart. The correct answer is option B, count the pulse for a full 60 seconds. An irregular rhythm requires a full minute count to improve accuracy. Short counts are less reliable when the rhythm is irregular. The findings should be measured and reported rather than skipped. Old values do not represent the current clinical status. Question 51. Following office protocol in an exam room, the bladder of a blood pressure cuff is not centered over the brachial artery. Which issue may occur? Option A, the pulse oximeter will stop working. Option B, the reading may be inaccurate. Option C, the patient will automatically faint. Option D, the oral temperature will decrease. The correct answer is option B, the reading may be inaccurate. Proper cuff placement over the brachial artery is needed for accurate auscultation. Blood pressure cuff alignment does not control the pulse oximeter. Incorrect cuff placement can be uncomfortable but does not automatically cause syncope. Cuff placement does not change oral temperature. Question 52. The care team in a specialty referral visit asks for guidance because a patient reports dizziness when standing and the provider requests orthostatic measurements. Which approach is most appropriate? Option A, record the first seated blood pressure as orthostatic. Option B, measure only oxygen saturation while the patient is seated. Option C. Measure blood pressure and pulse in different positions according to protocol. Option D. Have the patient walk quickly before the measurement. The correct answer is option C. Measure blood pressure and pulse in different positions according to protocol. Orthostatic vital signs compare cardiovascular response to position changes. A single seated reading does not show positional change. Oxygen saturation does not assess the blood pressure and pulse changes requested. Exertion can distort the readings and increase fall risk. Question 53. During a busy front office, muscle tremor artifact appears on an electrocardiogram tracing. Which intervention may improve the tracing? Option A. Remove all electrodes during the recording. Option B. Ask the patient to tense all muscles. Option C. Place the paper speed at 0. Option D. Help the patient relax and support the limbs. The correct answer is option D. Help the patient relax and support the limbs. Muscle tension and movement can create artifact, so comfort and support may improve tracing quality. Electrodes are required to capture the tracing. Tensing muscles increases electrical artifact. Paper movement is needed to record the waveform. Question 54. After reviewing the situation in a walk-in clinic, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A. Ear infection diagnosed today. Option B. Patient reports sharp right ear pain for 2 days. Option C. Patient seems dramatic about ear pain. Option D. Right ear normal after exam. The correct answer is option B. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. A diagnosis should not be documented by the assistant unless the provider has made it. Subjective judgment is unprofessional and not appropriate for the medical record. Exam findings belong to the provider and are not the chief complaint. Question 55. When a patient encounter unfolds in a clinical skills review, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A. Skip registration for returning patients forever. Option B. Code every visit as preventive care. Option C. Verify insurance eligibility at each visit according to policy. Option D. Use the oldest card in the file without asking. The correct answer is option C. Verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Returning patients can have changed insurance or contact information. Coding must reflect the service and documentation. Old cards may no longer reflect active coverage. Question 56. When a patient encounter unfolds in an administrative check-in area, a manual blood pressure cuff is too small for the patient's arm. Which result is most likely? Option A. The temperature will be elevated. Option B. The pulse oximetry reading will be inaccurate. Option C. The blood pressure may read falsely low. Option D. The blood pressure may read falsely high. The correct answer is option D. The blood pressure may read falsely high. A cuff that is too small can overestimate blood pressure because pressure is applied over too narrow an area. Cuff size has no direct effect on body temperature. Cuff size does not directly determine oxygen saturation accuracy. A cuff that is too large is more likely to produce a falsely low reading. Question 57. An office review in a same-day appointment shows that soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Soap and water help remove spores more effectively from the hands. Option B. Hand washing is needed only before eating. Option C. Alcohol sanitizer is always illegal in clinics. Option D. Gloves completely replace hand hygiene. The correct answer is option A. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Hand hygiene is required at multiple points in patient care. Alcohol-based hand rubs are appropriate for many routine situations. Gloves reduce exposure but do not replace hand hygiene after removal. Question 58. After reviewing the situation in a same-day appointment, an adult patient has no pulse and an automated external defibrillator is available. Which action is appropriate within training? Option A. Use the defibrillator on a conscious patient asking questions. Option B. Wait for the provider before starting any response. Option C. Give oral medication before checking responsiveness. Option D. Begin CPR and use the automated external defibrillator as directed. The correct answer is option D. Begin CPR and use the automated external defibrillator as directed. Early CPR and defibrillation improve response to cardiac arrest when performed according to training. An automated external defibrillator is used for suspected cardiac arrest, not an alert patient. Delaying basic life support can reduce survival. Oral medication is unsafe when cardiac arrest is suspected. Question 59. To protect safety in a pediatric clinic, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Tell the patient dizziness is impossible. Option B. Ask the patient to walk faster. Option C. Leave the patient standing while searching for forms. Option D. Assist the patient to sit or lie down safely. The correct answer is option D. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. Dismissing symptoms does not protect patient safety. Walking can increase fall risk when the patient is dizzy. An unsteady patient should not be left unsupported. Question 60. For a patient encounter in an exam room, a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the room number. Option B. Procedure code and diagnosis or reason for the service. Option C. Only the patient's favorite color. Option D. Only the assistant's initials with no service information. The correct answer is option B. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Room numbers do not describe the service or diagnosis. Personal preferences do not support claim coding. Initials alone do not provide billing codes or medical necessity. Question 61. Following office protocol in an urgent care office, the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A. Count for 5 seconds and multiply by 12. Option B. Count respirations while the patient is unaware of the measurement. Option C. Record the respiratory rate from the last visit. Option D. Ask the patient to breathe as deeply as possible. The correct answer is option B. Count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Very short counts are often inaccurate for respirations. Current respirations must be measured during the encounter. Deep breathing changes the normal respiratory rate and effort. Question 62. Before the visit continues in a phlebotomy station, the provider asks the assistant to prepare for a visual acuity test. Which tool is commonly used? Option A. Snellen chart. Option B. Hemostat. Option C. Tourniquet. Option D. Autoclave tape. The correct answer is option A. Snellen chart. A Snellen chart is used to screen distance visual acuity. A hemostat clamps tissue or small objects during procedures. A tourniquet helps locate veins for blood collection. Autoclave tape indicates exposure to sterilization conditions. Question 63. At the start of care in a patient education session, the term hypertension appears in the problem list. Which meaning is correct? Option A. Low blood glucose. Option B. High blood pressure. Option C. Joint inflammation. Option D is slow breathing. The correct answer is option B. High blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Low blood glucose is hypoglycemia. Joint inflammation is arthritis. Slow breathing is bradypnea. Question 64. An office review in a treatment room shows that the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A. Give the tracing to the provider promptly according to protocol. Option B. Discard the tracing to avoid alarming the patient. Option C. Change the tracing to make it look normal. Option D. Diagnose the rhythm for the patient. The correct answer is option A. Give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Abnormal results must not be hidden or discarded. Altering medical records is unethical and unsafe. Medical assistants should not provide a cardiac diagnosis. Question 65. A medical assistant is working in a procedure setup when a serum sample is needed for a routine chemistry test. Which tube type may be used according to facility protocol? Option A, lavender EDTA tube for serum. Option B, a red or gold serum tube. Option C, light blue citrate tube for serum. Option D, gray fluoride tube for all serum tests. The correct answer is option B, red or gold serum tube. Serum tubes allow clotting or include clot activator and separator depending on the tube. EDTA prevents clotting and produces whole blood or plasma, not serum. Citrate anticoagulant is used for coagulation testing. Gray tubes are not the standard serum tube for routine chemistry panels. Question 66. At the start of care in a walk-in clinic, a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A, review fasting instructions and route medication questions to the provider. Option B, tell the patient to stop all diabetes medications without provider input. Option C, tell the patient fasting means no restrictions at all. Option D, cancel the test because diabetes always prevents fasting labs. The correct answer is option A, review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Medication changes can be unsafe without provider direction. Fasting usually includes specific limits on food and drink. Diabetes requires careful instructions but does not automatically cancel testing. Question 67. During a walk-in clinic, the patient asks why they must lie still during an electrocardiogram. Which explanation is best? Option A. The machine cannot record any heartbeat unless the patient holds breath for 5 minutes. Option B, electrodes are used only to deliver medication. Option C, a movement can create artifact that makes the tracing harder to interpret. Option D, a movement changes the patient's blood type. The correct answer is option C. Movement can create artifact that makes the tracing harder to interpret. Stillness improves the quality of the electrical recording. Normal breathing is usually allowed, but excessive movement should be avoided. Electrodes detect electrical activity and do not deliver medication during a standard recording. Movement has no effect on blood type. Question 68. After reviewing the situation in a procedure setup, the suffix itis appears in a medical term. Which meaning is most accurate? Option A, study of. Option B, removal. Option C, pain. Option D, inflammation. The correct answer is option D, inflammation. The suffix itis generally means inflammation. Study of is commonly indicated by the suffix logi. Removal is commonly indicated by the suffix ectomy. Pain is commonly indicated by the suffix algia. Question 69. To protect safety in a same-day appointment, a patient says they cannot afford a prescribed medication. Which response is best? Option A, suggest sharing medication with a friend. Option B, tell the patient to stop all medications. Option C, ignore the comment because finances are private. Option D, notify the provider or appropriate staff so alternatives can be discussed. The correct answer is option D, notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Sharing prescriptions is unsafe and inappropriate. Stopping medication without provider guidance can be unsafe. The concern directly affects care and should be addressed respectfully. Question 70. When a patient encounter unfolds in a primary care office, a patient with limited English proficiency arrives for a consent discussion. Which resource is most appropriate? Option A, ask a young child to interpret. Option B, use a qualified medical interpreter. Option C, skip the explanation if the patient nods. Option D, speak louder and slower in English only. The correct answer is option B, use a qualified medical interpreter. A qualified interpreter improves accuracy, confidentiality, and informed communication. Children should not be used for medical interpretation because accuracy and family dynamics are concerns. Nodding does not prove understanding or valid communication. Volume does not remove a language barrier. Question 71. Following office protocol in a preventive care visit, an intradermal test is being prepared. Which description matches the route? Option A, medication swallowed by mouth. Option B, medication placed into the ear canal. Option C, injection into deep muscle tissue. Option D, injection just under the epidermis to form a small wheal. The correct answer is option D, injection just under the epidermis to form a small wheal. Intradermal injections are shallow and often create a small bleb or wheal. Swallowed medication is oral administration. Ear canal administration is otic. Deep muscle injection is intramuscular. Question 72. While working in a phlebotomy station, the assistant reviews where bile is stored before release into the small intestine. Which organ stores bile? Option A, pancreas. Option B, spleen. Option C, bladder. Option D, gallbladder. The correct answer is option D, gallbladder. The gallbladder stores and concentrates bile made by the liver. The pancreas produces digestive enzymes and hormones but does not store bile. The spleen is involved in immune and blood cell functions. The urinary bladder stores urine, not bile. Question 73. Following office protocol in a women's health clinic, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, give a diagnosis over the phone. Option B, follow emergency triage protocol immediately. Option C, schedule the patient for next month. Option D, tell the patient to send an email later. The correct answer is option B, follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Medical assistants should not diagnose the cause of symptoms. Routine scheduling can delay care for potentially serious symptoms. Potential emergencies require immediate action. Question 74. After reviewing the situation in a telephone triage workflow, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A, move the patient to a chair before assessing. Option B, finish documenting the previous visit. Option C, offer water by mouth immediately. Option D, activate emergency response and assess breathing according to training. The correct answer is option D, activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Unnecessary movement can cause injury and delay assessment. Documentation should not delay emergency care. Giving oral fluids to an unresponsive patient risks aspiration. Question 75. During a clinical skills review, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A, the electrodes inject medication. Option B, the test records electrical activity and does not deliver a shock. Option C, the test shocks every patient to start the heart. Option D, the machine draws blood through the wires. The correct answer is option B, the test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Electrocardiogram leads do not collect blood. Question 76. In a telephone triage workflow, a staff member shares an electronic health record password to save time. Which risk is created? Option A, loss of accountability for chart access. Option B, better sterilization monitoring. Option C, improved privacy protection. Option D, automatic insurance approval. The correct answer is option A, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Login credentials do not sterilize instruments. Password sharing weakens privacy and security. Passwords do not control payer authorization. Question 77. An office review in a clinical skills review shows that a sterile dressing change is being prepared. Which action helps maintain sterility? Option A, reach across the field with unsterile clothing. Option B, reuse sterile gloves from a previous patient. Option C, open sterile supplies without touching the inner sterile surface. Option D, place sterile gauze on an unclean counter. The correct answer is option C, open sterile supplies without touching the inner sterile surface. Avoiding contact with sterile surfaces helps preserve the sterile field. Reaching over the field can contaminate it. Sterile gloves are single-use and patient-specific. An unclean surface contaminates sterile supplies. Question 78. For a patient encounter in a women's health clinic, a provider orders a capillary blood glucose test. Which site preparation is important? Option A, use the first visibly dirty drop for every test. Option B, puncture through visible dirt. Option C, clean and dry the puncture site according to protocol. Option D, skip patient identification because the test is quick. The correct answer is option C, clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Site contaminants can affect the first drop depending on protocol. Contamination can affect the sample and infection risk. Patient identification is required even for quick point-of-care tests. Question 79. While working in an electronic health record review, a coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A, open the chart if the coworker promises not to tell anyone. Option B, share the chart because staff work in the same clinic. Option C, deny the request because there is no job-related need to know. Option D, print the chart and remove the patient's name only. The correct answer is option C, deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. A promise does not create a permitted reason for access. Employment at the same clinic does not automatically authorize chart access. De-identified information must meet specific standards and curiosity is not permitted access. Question 80. The care team in a patient education session asks for guidance because a laboratory result is critical and the protocol requires immediate notification. Which action should the assistant take? Option A, discard the result because it is abnormal. Option B, tell the patient the exact diagnosis without provider review. Option C, notify the provider or designated clinical staff promptly. Option D, file the result for review at the end of the month. The correct answer is option C, notify the provider or designated clinical staff promptly. Critical results require rapid communication so the care team can respond. Abnormal results must be reported, not discarded. Diagnosis and interpretation belong to the provider. Delaying a critical result can put the patient at risk. Question 81. A medical assistant is working in a preventive care visit when the assistant teaches a patient how to prepare for a fasting laboratory test. Which method best confirms understanding? Option A, ask only whether the patient has any questions. Option B, give instructions as quickly as possible. Option C, use medical jargon to sound professional. Option D, ask the patient to explain the instructions back in their own words. The correct answer is option D, ask the patient to explain the instructions back in their own words. Teach back checks whether the patient understood the instructions and allows correction of misunderstandings. Patients may say no even when they misunderstand instructions. Rushing can reduce comprehension. Jargon can confuse patients and reduce understanding. Question 82. During an outpatient laboratory, a chain of custody urine drug screen is collected. Which practice is most important? Option A, document each transfer and maintain specimen integrity. Option B, skip signatures if the specimen looks normal. Option C, use an unlabeled container until the lab receives it. Option D, allow the patient to take the specimen home first. The correct answer is option A, document each transfer and maintain specimen integrity. Chain of custody documents who handled the specimen from collection through testing. Appearance does not replace custody documentation. Unlabeled specimens can be rejected and cannot be reliably traced. Uncontrolled possession breaks specimen integrity. Question 83. A medical assistant is working in an urgent care office when a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A, adjustment. Option B, deductible. Option C, copayment. Option D, premium. The correct answer is option C, copayment. A copayment is a fixed amount the patient pays for a covered service. An adjustment changes the billed amount based on contracts or corrections. A deductible is the amount the patient pays before insurance begins paying according to the plan. A premium is the amount paid to maintain insurance coverage. Question 84. A medical assistant is working in a walk-in clinic when a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, increase oxygen without reporting the finding. Option B, ignore the waveform and record the lowest value. Option C. Warm the finger or choose a better perfused site. Option D. Place the probe over wet nail polish. The correct answer is option C. Warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Medication or oxygen changes should follow provider direction and clinical protocol. An unstable signal should be corrected before documenting the value. Moisture and polish can interfere with sensor performance. Question 85. For a patient encounter in a patient intake station, a patient needs crutch walking education after provider instruction. Which principle is important? Option A. Crutches should fit properly and not press into the axilla. Option B. Crutches should be used only on wet floors. Option C. The patient should skip follow-up if pain increases. Option D. Body weight should rest mainly on the armpits. The correct answer is option A. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Crutches are mobility aids and wet floors increase fall risk. Worsening symptoms should be reported according to instructions. Weight should be supported through the hands, not the axilla. Question 86. During a certification exam scenario, a patient has a red allergy band on the wrist. Which action should occur before medication administration? Option A. Ignore the band if the patient seems healthy. Option B. Remove the band so it does not worry the patient. Option C. Give medication first and ask about allergies later. Option D. Verify the allergy information in the record and with the patient. The correct answer is option D. Verify the allergy information in the record and with the patient. Allergy alerts must be checked before medication administration to prevent reactions. Allergy risk is not based on appearance. Removing an alert without direction can create risk. Allergies must be checked before administration. Question 87. While working in an outpatient laboratory, a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A. Wipe the surface dry immediately. Option B. Use the disinfectant only on clean hands. Option C. Keep the surface wet for the full listed contact time. Option D. Dilute the solution more to reduce odor. The correct answer is option C. Keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Removing the disinfectant too soon can make it ineffective. Environmental disinfectants are not hand hygiene products. Unapproved dilution can reduce disinfectant strength. Question 88. When a patient encounter unfolds in a treatment room, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A. Assume the patient cannot participate. Option B. Shout from another room. Option C. Face the patient and speak clearly at a moderate pace. Option D. Cover the mouth while speaking. The correct answer is option C. Face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Hearing difficulty does not mean the patient cannot understand or decide. Shouting from a distance reduces clarity and privacy. Covering the mouth removes visual cues. Question 89. The care team in a patient intake station asks for guidance because a patient asks for printed medication instructions. Which practice improves health literacy? Option A. Provide instructions in the wrong language. Option B. Tell the patient to search online without guidance. Option C. Use clear language and review the key points with the patient. Option D. Use only complex medical terminology. The correct answer is option C. Use clear language and review the key points with the patient. Plain language and review help patients understand and follow instructions. Language mismatch can prevent safe understanding. Unguided online searching may provide inaccurate or confusing information. Complex terms can reduce comprehension. Question 90. While working in an urgent care office, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A. Leave the fax confirmation on a public counter. Option B. Verify the recipient fax number before sending. Option C. Include unrelated patient charts in the same fax. Option D. Send it to a number from memory without checking. The correct answer is option B. Verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Confirmation pages may contain protected information and should be handled securely. Only necessary information should be disclosed. Memory errors can lead to misdirected protected information. Question 91. To protect safety in a women's health clinic, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A, RACE. Option B, PRN. Option C, NPO. Option D, SOAP. The correct answer is option A, RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. PRN means is needed and does not guide emergency fire response. NPO means nothing by mouth and is unrelated to fire safety. SOAP is a documentation format and does not guide fire response. Question 92. To protect safety in a pediatric clinic, a medication order is present but the patient reports an allergy to the drug. Which action should occur before administration? Option A, administer the medication because it was ordered. Option B, change the medication to another drug independently. Option C, ask the patient to sign a form and give it anyway. Option D, hold the medication and notify the provider. The correct answer is option D, hold the medication and notify the provider. A reported allergy is a safety concern that must be clarified before giving the medication. An order does not override a possible allergy. Medical assistants do not independently substitute medications. A form does not make an unsafe medication appropriate. Question 93. In an exam room, a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A, leave the old pharmacy because it is already in the chart. Option B, delete all pharmacy information from the record. Option C, update the preferred pharmacy after verifying the new information. Option D, choose the pharmacy closest to the clinic. The correct answer is option C, update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. Outdated demographic information can delay medication access. Removing needed information can interrupt prescribing workflows. The preferred pharmacy should come from the patient rather than staff convenience. Question 94. At the start of care in an exam room, a patient has been drinking hot coffee immediately before an oral temperature. Which action should the medical assistant take? Option A, wait according to office protocol before measuring the oral temperature. Option B, record the temperature as normal without measuring it. Option C, take the temperature immediately because oral readings are unaffected. Option D, switch to a rectal temperature without asking. The correct answer is option A, wait according to office protocol before measuring the oral temperature. Hot or cold intake can temporarily alter oral temperature and lead to an inaccurate reading. Vital signs must be measured rather than assumed. Recent liquids can affect oral temperature results. Changing to an invasive route requires proper indication and protocol. Question 95. For a patient encounter in a pediatric clinic, coordination of benefits is needed. Which situation does this usually involve? Option A, a patient has more than one insurance plan. Option B, a patient needs a sterile dressing. Option C, a patient has one cash payment only. Option D, a provider orders a throat swab. The correct answer is option A, a patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. Dressing supplies do not create coordination of benefits by themselves. One cash payment does not require multiple plan coordination. A throat swab order does not itself involve multiple insurance plans. Question 96. Given the workflow in a certification exam scenario, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A, oxygen saturation and pain score. Option B, height and weight. Option C, blood pressure and temperature. Option D, pulse and respirations. The correct answer is option B, height and weight. Body mass index is calculated from height and weight. Oxygen saturation and pain score provide different clinical information. Blood pressure and temperature do not determine body mass index. Pulse and respirations are vital signs but are not used to calculate body mass index. Question 97. Before the visit continues in an infection control audit, lead V1 is being placed for a standard 12-lead electrocardiogram. Which location is correct? Option A, fourth intercostal space at the right sternal border. Option B, fifth intercostal space at the left midclavicular line. Option C, left arm below the clavicle. Option D, a fourth intercostal space at the left sternal border. The correct answer is option A, fourth intercostal space at the right sternal border. V1 belongs at the fourth intercostal space on the right side of the sternum. That location corresponds to V4 in standard placement. The left arm electrode is a limb lead site, not V1. That location corresponds to V2. Question 98. An office review in a women's health clinic shows that the QRS complex is reviewed on an electrocardiogram. Which event does it mainly represent? Option A, ventricular depolarization. Option B, atrial repolarization only as the visible main event. Option C, a lung gas exchange. Option D, ventricular filling with blood only. The correct answer is option A, ventricular depolarization. The QRS complex represents electrical activation of the ventricles. Atrial repolarization is usually hidden within the QRS complex. Gas exchange occurs in the alveoli, not on the QRS waveform. Mechanical filling is not the primary electrical event represented by QRS. Question 99. While working in a procedure setup, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A, place the stethoscope over the abdomen. Option B, use the thumb to feel the pulse. Option C, place 2 or 3 fingers over the radial artery at the wrist. Option D, count respirations before locating the pulse. The correct answer is option C, place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The abdomen is not used for a routine radial pulse. The thumb has its own pulse and can interfere with accurate counting. Respirations are measured separately and do not identify the pulse site. Question 100. Given the workflow in an infection control audit, a pelvic examination is scheduled. Which patient position is commonly used? Option A, Sims. Option B, lithotomy. Option C, Trendelenburg. Option D, a prone. The correct answer is option B, lithotomy. The lithotomy position is commonly used for pelvic examinations. Sims position is often used for rectal procedures or enemas. Trendelenburg places the head lower than the feet and is not the routine pelvic exam position. Prone means lying face down and is not the common pelvic exam position.